All right, as promised, we are joined by the Murang'a Governor, Irungu Kang'ata, no stranger to the Citizen Studios. We also have with us the lovely Naomi Monari, not Naomi. She's the founder, Benacare, and we also have a nephrologist in studio, Dr. James Kahura. Good to have all three of you here. So what we are discussing today is the launch of a mobile dialysis truck. Perhaps, Governor, can you tell us a little bit more about that?
Yes, Murang'a County has a huge burden of persons with non-communicable diseases like hypertension, diabetes, and by virtue of being fairly a county with many elderly persons. And it reaches a stage where they get complication of the kidney. Some of them are in remote places. And therefore, we thought of getting into a partnership where we were able to acquire, through the support of Benacare, a mobile truck fitted with dialysis that will be moving from one health center to another health center, and therefore patients in the remote places of Murang'a, they don't have to take long routes or fare to reach the medical care.
Currently, in what health centers is this service provided?
Okay, Murang'a has 3 regions basically. So the people in Keharu, Kangema, Madhia region can go to Murang'a Level 5 Hospital, which we have added new dialysis machines. There used to be 4, they are now 12. We have established a second dialysis center at a place called Kigumo to serve the people of Maragua and Kigumo. Now this new truck now will basically serve health centers in the lower part of Murang'a and also Gatanga and Kandara region.
Okay. Naum, how did this partnership come about? Because my understanding is that it is a public-private partnership.
Exactly. Thank you so much. So we had, in 2023, conducted a research into the modalities available for the treatment of chronic kidney disease in Murang'a County, together with Jomo Kenyatta University and Dr. Kahora. And we established that there was a burden of accessibility of dialysis services. And then the researchers came up with a recommendation that we actually needed to improve accessibility of dialysis services. And then so we partnered with the county, and this is the result.
All right.
Yeah.
Doctor, are you involved in this research?
Yes, I am. I was involved. Yeah, we did. We conducted a survey in Murang'a, looking at the basically mapping out where patients come from, and we concluded that some patients do travel long distances to access dialysis, and that's how we came up with this idea of coming up with a mobile truck. We realized this distance covered contributed significantly to mortality and other morbidities in patients who have renal failure. And that's why we did this.
Okay.
Yeah.
So, Governor, is it just the one truck? Are you planning to expand? What's the plan moving forward?
Well, we are happy to report now dialysis services in Murang'a, they are fairly accessible because now, as I've said, in Murang'a Level 5 hospitals, we now have more machines. For the first time, a rural facility called Kegumo Hospital has about 4 or 5 machines. And now we are adding a new set, but now on track. And therefore, we think we are covered. But if need be, we'll definitely do more. Murang'a has been doing a lot of intervention in matters of healthcare. You know, we have that medical insurance card for the poor people, where we pay on behalf of those who can't afford the medical insurance for certain category of Murang'a people. We also have telemedicine and also other building new hospitals. We are not saying that we are 100% perfect, no way. It's a journey, but I think this is quite an important journey, particularly bringing dialysis services in a mobile manner. I think I would imagine it's the first one in the region.
Yeah. Is it, Naum, is it the first in the region?
It is the first in Kenya, that we know, and arguably the first in Africa. This we will confirm, and we think it is going to actually revolutionize how healthcare is being provided, because for you to have very highly specialized clinical care in a truck like dialysis, this opens up the mobile health in Africa, where we would see maybe a mobile chemo mobile, maybe ICU in the future. Yeah.
Dr. Kahura, were you involved in the design of the truck? Basically, Naom, between the two of you, can tell us what was involved in the development of this truck, because dialysis is something that takes time.
Yeah.
How many people can you offer services at one go? You know, electricity connection, are you using solar panels? Perhaps you can give us a little bit more detail about this truck.
Yeah, what we did, we borrowed this from other countries which have done this before. The Odulair in America do offer mobile dialysis. Some parts of Australia also do offer mobile dialysis. And we did our search and came up with a model that we can adopt in our country, considering that the terrain in this country, the kind of patients that you handle. And basically what we came up with is a dialysis unit fitted on a truck. And by so doing, it means that we've been able to establish more than 3 dialysis brick and mortar kind of on a truck, which would be more expensive. But being on a truck that is mobile, it's like you've done 3 dialysis units, because you'll be visiting more than 3 health centers at any one particular week. And it's the level gold standard kind of a dialysis unit. We do have a water treatment plant inside there with very good water. We've done the assessments. We've got the best of the machines. We are going to be offering quality hemodialysis, what is offered in the best of the countries, what we call hemodiafiltration. And we are raring to go. Yes.
All right. Perhaps, Governor, you know, what kind of impact are you looking for this to have? You know, do you have certain numbers in mind?
Yes, the numbers are many, but we'll know them once we get people who come and register. But healthcare, we don't look from a numerical point of view. One life is as important as 10 lives. Having a situation where we lose even a single person of Moranga because of the distance between home and a hospital, to us is bad. And therefore, to the extent, even if that machine will care for a single patient in Kirwara or in Gatora, in Gatanga, or even in Makuyu, in Maragua, to us is important. We have saved a life. Maybe it's a mother, it's a father, yeah, who has been saved. And I know this problem is quite acute. A lot of people of Moranga are really getting kidney failures. And therefore, I think we have a moral duty to save each life and ensure we give better quality of health care to the people of Moranga, and I would imagine every Kenyan citizen deserves that.
All right, Dr. Kahura, numbers-wise, quickly, what did your research show? How big is the gap?
It's huge. It's huge. It's humongous. Moranga, being a county in the central Kenya, has a disproportionate burden of communicable diseases, hypertension and diabetes, and consequently an equal big number of patients with chronic kidney disease. And the numbers are huge. And dialysis is basically a stopgap. It's stopgap as you prepare those patients for possible kidney transplantation. But if you don't save their life when they need dialysis, then you not have them when you are doing kidney transplantation. On top of that, we hope to incorporate preventative strategies of screening. So on that track, we are also going to be doing blood sugar, we'll be doing urinalysis and all that, and also possibly do the kidney function tests, which are very important. And going forward, we hope on improving on this track. Yes.
All right. Noam, the very last word as the founder of Benacare.
This is decentralizing healthcare. And with this mobile truck, I think we are beating the cost matrix, because with one infrastructure, we are able to serve 3 areas of Moranga County. And so I feel like this is the blueprint for mobile health in Africa, and I'm excited to see where this goes. But also, from what you asked about the fabrication, I would like to also state that this is made in Kenya by Juakali Artisans, by Containers Kenya, by Crown Healthcare, made in Kenya, and it's awesome.
All right, thank you very much. We have had in studio the Moranga Governor, Irungu Kang'ata. He was here a couple of weeks back, school feeding, telemedicine, as he mentioned. Now, the new innovation has to do with mobile dialysis. We've also had in studio Naom Monari, who is the founder of Benacare, and we've also had a nephrologist in studio, Dr. Kahura James. Thank you very much for being here. We take a break, but Friday night continues on the other side.